Hello, my name is Clifford Enyita. Today, I'll be speaking on a medical condition which affects the brain called stroke. Stroke affects majority of people worldwide. It affects both young adolescents, elderly, men, and women. So, there are two types of stroke. One is hemorrhagic stroke. Hemorrhagic stroke is when the small arteries or any artery in the brain breaks up and begin to leak blood into the brain tissue, causing damage to the brain tissues. And there is also ischemic stroke, which is when there is a blood clot from any part of the blood vessels gets into the brain and blocking blood supply to the brain within the brain, causing damage to that particular brain tissue. Stroke itself is not a disease, but other things are what that causes stroke. For instance, our lifestyles and other diseases that affects our body. Example of diseases which affects our body that can cause stroke include hypertension, that is raised blood pressure. Uncontrolled raised blood pressure can cause stroke. Diabetes also can cause stroke. While other risk factors which can cause stroke include if you are getting older, if you smoke cigarette, if you do drug abuse, if you drink alcohol in excess. All these things combined together, or one of it, could predispose you to developing stroke at one stage or the other in your life. What are the signs of stroke? Signs of stroke include if you're having a unilateral drooling in your face, that is drooling on one side of your face, with your forehead being spread. If your speech begins to be stuttered or impaired, or you're finding difficult to speak, or you're finding difficult to drink or swallow. If you are beginning to have weakness in one of your hand or your legs or both, finding it difficult to walk or move your hand, those are signs of stroke. Now, what would you do if you see any signs of stroke? What you need to do is to arrange to see your doctor immediately. Do not wait and think, oh, you want the symptoms to get away. There are also transient ischemic stroke, which the symptom can resolve almost within an hour. Do not think that, oh, it has resolved, therefore you relax. As soon as you see any of these symptoms, see doctors immediately. What will you do to prevent yourself from getting stroke? What you can do is ensure that your blood pressure is well controlled. Ensure that your diabetes, if you have diabetes, is well controlled. Don't drink alcohol in excess. Eat healthy diet. Ensure physical exercise every now and then, following World Health recommendation, at least 150 hours of work every week. If you are doing all of this, I assure you, you can be healthy and reduce your risk of developing stroke. Stroke is preventable. Stroke is curable. If you see the sign of stroke, see your doctor immediately. What you must not do is, if you do have sign of stroke, do not take aspirin until you see your doctor. This is because aspirin can worsen your condition. If, for instance, your own type of stroke is a hemorrhagic stroke, only your doctor will determine which medication is right for you and what next needed to be done for you to get you better. Thank you very much for listening. I wish you all the best.